Okay, so that's that. Now, turn to the last page for this stuff, because everything's already written. A lot of stuff is already written, thank God. If you look at the last page, you'll see some information about cold stress. And here, you're going to want to remember to write 4 ways we lose heat. That would be conduction, it's written on the board, conduction, convection, evaporation, and radiation, which is already on the board. And make sure you just write worse, way worse with high-risk babies. Heat loss is much worse with high-risk babies. Now, we have a handout already on some of that stuff. If you go back a little bit, I just realized we have a nice little handout that you don't have to write as much as you would on this one. Maybe 3. Oh, there it is. Newborn assessment. Keep going backwards. Yeah. Keep going backwards a little bit. Oh, yeah. You're going to flip. Yeah. Yeah. It looks like this. Maybe a little bit backwards. It's really nice. If you look at this handout and you go over to the right-hand side, I have a couple things you need to highlight. Where you see a picture of the scale, you needed to know that babies lose 5 to 10% of their weight in the first few days of life. So here we have weight loss. We can erase that. They lose 5 to 10% of their weight in the first few days of life. Now look when they regained it. Over the next couple weeks, they regain it. If you go over to lung maturation a little bit further down, you'll see it says lung function after 26 weeks. Surfactant is okay at 35 weeks. What you doing? You looking for that page? Help her find her page, child. It's at the back. Yeah, you're in the right direction. You might have just missed it a second ago. Yeah. Well, they're not in any order. Just page by page. Okay, now, so if you look at the surfactant being okay at 35 weeks, we know babies start to produce it at 22, which is why you have that 22 up on the board about when should we do, CPR and all this crap. We know that they don't produce it until 22. They accelerate their production at 26, and then they perfect it by 34, 35 weeks. When we are looking at a diabetic mother, do you remember me saying we're never going to let her see her due date? Okay, we have to make sure we write in this section, we're going to do an amnio for LS, it's called LS ratio. So put that in that little area. We start doing an amnio at 34 weeks, which I mentioned before, for an LS ratio on all diabetic moms to tell when their fetal lungs are mature. An LS ratio less than 2 to 1 is bad. Can't deliver her. Got to try it again in another few days. If it's greater than 2 to 1, we can deliver her. And it's called an LS ratio. We started 34 weeks. 4 weeks we start. Now, if you look at the Apgars up in the upper left-hand corner, there's a better way to remember it, and this is what I tell you to write. You know, you always got to have a good mnemonic for this shit. That stuff gets confusing after a while. A is for appearance. Here you're talking skin color. Perfectly pink, which no one ever gets credit for. Perfectly pink baby is 2 points. Acrocyanosis, which is normal, blue fingers and toes, is 1 point. So acrocyanosis, which is blue fingers and toes, is 1 point. P is the pulse rate. If it's less than 100, 1 point. Greater than 100, 2 points. The G is for grimace. And I tell you to think of this as response to stimuli. And one of the most common stimulus we give is that damn vitamin K shot. If you didn't cry, that's only a point. If you cried, yes, if you were mad at me, this is good. So how irritated were you with stimuli? That's the key. Stimuli. With no stimuli, you screaming your head off, you automatically got 2 points. I ain't did shit to your little ass, now you're screaming. So you get 2 points when you come out screaming. You're pissed off, like, could have left me in my swimming pool. All right, now the other A is for activity, and specifically this is tone. So a baby should be moving all around, doing all kinds of crazy stuff. Frisky, crazy, wild child. And that would be 2 points if you're just doing you. Very actively engaged in what you're doing. If they are just kind of quietly laying there, but they are this way, flexed, so they are balled up, they're flexed, well, I won't give them 1 point. If they're a limp dishcloth, like they don't know what the hell hit them, 0. And I do get those babies. They're not good. They come out literally, what did you do to me? The R is respirations. If you're crying, your respirators are automatically a 2. If you're breathing, but you ain't too turned on about crying, it's a 1. So you're breathing, you are. I see rise and fall of the chest, but you ain't crying. I'm really not too interested in crying. There's no lusty cry. Preemies do that. They don't really have a whole lot going on in the cry department. So those are your Apgars. The other issue on that page is if you go down to the very bottom, we've got some distress going on around here. And so we need to look at that area and show you what happens when our baby's not happy. You should see something down there, hopefully like grunting, flaring, retracting, anything like that in there. You see any grunting or circumoral cyanosis or... Oh, you do? Okay, good. Okay, so if you look at this business at the bottom, this respiratory system deal, you can see a loud and lusty cry is a good thing. Make sure you put feeble, weak cry for premature babies. Feeble, weak cry for preemies. Feeble, weak cry for premature babies. Where it says retractions, this is the intercostal spaces, movement of soft tissue, retractions, movement of soft tissue in the intercostal spaces. We also say it's accessory use of muscles to breathe. This is obviously not good. It usually goes with something called grunting, flaring, grunting can be, well, it is an external sound that represents atelectasis. It's definitely respiratory distress, and it represents atelectasis. Remember, with atelectasis, your alveoli are closed. Your alveoli are closed. With flaring, it's an inspiratory sound. So you do it when you breathe in. It's not even a sound, it's an action. Together, grunting, flaring, retracting is classic respiratory distress syndrome. Classic respiratory distress syndrome. Grunting, flaring, retracting. Very bad. Don't want to see it. Really, really awful. Horrible. You name it. And it's that. The singing that it sounds like they're doing is not good at all. If you look on there, you'll see the ways we lose heat also. And I like how it has the examples on there. The best way to prevent evaporation is to dry the baby off. Common sense. The best way to prevent evaporation is to dry the baby off. The best way to prevent convection, heat loss through convection, is to make sure that wherever you put this baby, it's not near a fan or an air conditioner. So we don't put the baby in front of drafty windows, ceiling fans. Convection means movement of air. Okay. To prevent heat loss from conduction, we warm our stethoscopes. We warm our stethoscopes, and we don't put the baby on a cold scale to weigh it. To prevent heat loss from radiation, you'll never see a newborn nursery with windows to the outside weather. Newborn nurseries are in the middle of the hospital unit. They're never near windows to the outside. Because if you put a scale here to this window, the cold from the window will go to the baby, the heat from the baby will go to the window. That's radiation. It's radiating off of the baby. to the window. The cold air is radiating off the window to the baby. A bunch of craziness. Absolutely not cool. Okay. Now, how serious is this shit? Oh my God. Very, very serious. So you're going to need to write some notes about cold stress. And this is why I had you go to the last page and write the ways that we lose heat. Because I wanted to tell you some things that happen when we lose heat. So the initial response to the baby losing heat is that their metabolic system increases. Their metabolic rate increases. Now, you're going to know that because they're going to breathe fast. So they're going to have tachypnea. When the baby loses the heat, it has no choice but to go after its stores of brown fat. It is going after this brown fat because brown fat is a source of energy. Energy is a source of heat. So it's going to go after the brown fat, and this is going to give the baby fatty acids. So we're going to go into metabolic acidosis just from burning up the brown fat, which is crazy. Bad as if that's not bad enough, whatever blood sugar the baby had, they're about to burn it up. So they're going to become hypoglycemic. So they're using up whatever blood sugar they have for energy and heat, and they become hypoglycemic. Now the baby's going to produce less surfactant. With a low blood sugar, this causes jitteriness. Low blood sugar equals jitteriness. Low surfactant equals respiratory distress syndrome. This increased need for oxygen is creating a hypoxia. So your baby's hypoxic. So what do we got? We've got a hypoglycemic, a hypoxic, a metabolic acidotic, cold baby. And when you talk about hypoglycemia, now you're going to burn brain cells. You're going to kill them. So you're going to have a problem all the way around. And now we're in respiratory distress. So you can imagine that just letting the baby get cold is crazy. What's the best way to warm up a baby? Skin to skin. If you don't have the skin, we say double wrap and cap, put them under the warmer, do something. Don't just sit there like a bump on a log here because we're going to have some drama. And don't forget the burning of brown fat gives you fatty acids or metabolic acidosis. Burning of brown fat gives you fatty acids or the metabolic acidosis.
And those are all examples of cold stress.
Mm-hmm. Low blood sugar, which is your hypoglycemia, hypoxia, respiratory distress, burning the brown fat, metabolic rate increases, your baby's tachycardic. It's just a bunch of crap. All because baby got cold. Okay? Now, you have some vital signs you got to make sure you know. Obviously, you have more room on this sheet. So let's put some normal vital signs. A newborn gets 1 blood pressure. Make sure you write this down. A newborn gets 1 blood pressure in the newborn nursery. To check for a congenital, cardiac, heart defect. You're only screening for it. You can't test for it. You're screening for it. Now, this blood pressure is done on the arm and the leg diagonally across from it. So right arm, you can use right arm and the leg diagonally across. And what we're going to do is we're going to compare them. And we cannot have a blood pressure higher in the arm than the leg. Otherwise, we have a congenital heart defect. Generally, it's a coarctation, but you don't need to probably know that. But it's a congenital heart defect nonetheless. So that's the only blood pressure, and there's only one reason to do it, and that's to screen for cardiac defect. Not because we're so interested in newborn blood pressures, because we're not. Okay, so that's that. Now the heart rate, we have to make sure we're clear on this heart rate. What'd you say, baby? You're looking at 120/60, 110 with sleeping, 180s with crying. Okay? So a normal newborn heart rate, 120s to 160s, 110 with sleeping, 180 with crying. Murmurs are common. Murmurs are very common. Murmurs are common. Respirations will get you into trouble if you don't know what you're doing. So let's look at respirations. The problem with respirations is that there is no problem when they are irregular. In a newborn, it is perfectly normal and natural and absolutely fine, and nobody gives a shit if your newborn has irregular respirations, because they all do. So 30 to 60 for respirations is what we expect. Preemies may be slightly higher in their heart rates. Preemies may be a little higher in their heart rates, but not their respirations. Preemies may be a little higher in their heart rates, but not their respirations. I don't like the temperature on your handout, so we have to change it. The temperature on your handout needs to be changed from 36.5 to 37. That's a normal temperature for a baby. That one on your sheet is too cold. If you look at your other newborn handout, I think they have some vital signs on there too. I want you to highlight it, the other one you were on. If you look at the bottom, oh good. If you look on the left-hand side, It talks about the circulatory system that's on my board here. On your handout, this part. It's kind of nice the way they have it, because they're talking about some of the circulation changes that a baby goes through. So you care that we close the ductus arteriosus, foramen ovale, and that's on the board. You actually care that we close those things. So highlight those because they're important. That has to happen for the baby to transition to extrauterine life, and you can see that. You can see it says transitory murmurs, which means things are normal. If there's a murmur, it's okay. It's transition. And you can see acrocyanosis. I told you that was normal. You can see the heart rate, 120 to 160, normal. So you got a lot of good stuff there. Then if you go over to the far right side, you'll see normal respiratory rate. And you just need to write irregular. Way on the far right-hand side, you got that normal respiratory rate, and it's 30 to 60, perfectly normal. So this is a nice handout to kind of get you to know your little norms for baby. Okay. We're done with that. You can see the whole issue of brown fat as it relates to getting a cold baby. Do you see where it says chilling? And it says you have an increased need for oxygen because you're consuming more of it. Talks about you using your glucose, getting to be hypoglycemic. Right next to where it says brown fat, you can write your fatty acids, and metabolic acidosis is already there. And then it talks about decreased surfactant production. I mean, it's a good handout for all your little baby crap that happens.